Hi, I'm Lynn Shurtleff. I am an independent insurance agent here in the area. I have been in this area for over 30 years, specifically Hampton, so I am local. I carry all plans. This seminar today is not a sales seminar, it's for education only. So just want to let you know that we're going to be going over Medicare. So let's get started. Part D, so this is where the prescription drugs come in. Part D is what covers your prescription drugs. It's offered only through private insurance companies. Even though it's called Medicare Part D, there are no Medicare plans. They all are through private insurance companies. It is always best to make sure you get the plan that is going to fit your medications the best and give you the lowest overall cost. The costs on these plans are going to vary from plan to plan. Catastrophic coverage protects you if you fall into the catastrophic area from high drug costs. The benefits can and do change from year to year. That period that's in the fall, the annual enrollment period that happens every fall from October 15th through December 7th is the period that you can review the changes for the plan you're on and other plans and see if that's still going to be the right fit for you for the next year. Each plan has a list of drugs that it covers. This is called a formulary. It can change from year to year. They can add drugs, they can take drugs off. There is a Medicare model for a Part D that the plans do have to follow, but then they can alter it to be competitive and to give their members the best benefits. Coverage is not automatic, and if you do not enroll in a Part D when you're first eligible, you will have a penalty. That penalty is going to be 1% of the national average premium for every month that you do not have a Part D. So it is not advisable, even if you're not on any medications, to not sign up on a Part D, because it may cost you a lot more down the road. For the formularies or list of drugs, they all are going to have tiers. Most of them have 5 tiers now. There's 1 or 2 that do have a tier 6, but most of them we're just going to have 5 tiers on there. The lower the tier number, the lower the cost of the medication for you. Not necessarily the total cost, but the cost for you. If it's a generic, do not assume it's going to be a tier 1 or tier 2. Generics fall on all 5 tiers. So as you can see by the list there, that costs go up. Tier 5s are going to be specialty medications, and those can be fairly costly. Lots of times those are high cost cancer medications and some others in that category. For the coverage stages of a Part D, so here's where you hear about this donut hole all the time. It's actually called the coverage gap, but most folks do know it as the donut hole. When you're on a Part D, you start out in either the deductible stage or the initial coverage stage. Not all plans have a deductible. Most of them now seem to have the standard Medicare deductible in there for upper tiers, but they can have the deductible for all 5 tiers. If your plan has an annual deductible, you have to pay that out of pocket first before the tier level amounts kick in. If it does not, you start out in the initial coverage. So when you're in the initial coverage, it is the total cost of the medications, not what you're paying, but what you're paying and the insurance company is paying. When that reaches, every year it's a different amount. They do change this in the fall, but this year it is $4,020. So when the total cost reaches $4,020, you fall into the hole or the coverage gap. While there this year, you pay 25% for the cost of name brands and for generics. Some plans will have the lower tiers, the tier 1s and or the tier 2s, where you still pay whatever the copay was. But tier 3s, 4, and 5, they're all going to be on the 25% level. To get out of the donut hole or the coverage gap, you have to have an out-of-pocket of $63.50 this year. That lands you in that catastrophic coverage or the catastrophic stage. And through the end of the plan year, this will start over. Every January, you pay much lower costs for your medications at that point. For this year, the Medicare standard deductible for a Part D is $435. Some plans will have it lower than that. Some plans will not have one at all. But you don't ever want to pick a plan for simply a deductible or not a deductible or a lower deductible. You want to make sure that you do it for the overall cost for your medications, because that can make a big difference. The initial coverage limit, once again, is $4,020. There's the 25% for when you fall into the hole or the gap. Catastrophic coverage, $63.50 out of pocket. This is not a true out of pocket because they are counting a percentage of the amount for name brands only to help get you out of the hole quicker. When you're in the catastrophic stage, you pay $3.60 or 5% for generics and $8.95 or 5% for name brands. So if you have any questions, please contact me. You may email me, call me, let me know. We can set up individual appointments to go over your situation specifically. Once again, I am an independent agent, so I carry all of the companies and will work to get you on the best plan for you. You can also contact medical care if you need my information, and then we'll go from there. Once again, I'm Lynn Shurtleff. I am a local independent agent. I do carry all companies, and if you need any help with anything, even if you have been on Medicare for many years and have questions or need some assistance with your plan or need to review for next year, just give me a call or email me. Thanks for watching and have a good day.